All right, so welcome everyone, and thank you for joining us today for our questions and experts session. So my name is Bakun Adebembo, and I'm the manager of operations with the Canadian Breast Cancer Network. Thank you for joining us today for a session with Melissa Harley. And just before we get started, I just want to go over some housekeeping items. So to begin with, this session is being recorded and it will be made available on our website in case you want to watch it back, or if you want to share with someone who wasn't able to join us live. And I'll also be posting the link in the chat of where you'll be able to find this webinar when we post it, as well as our other sessions that we've had. I'd like to extend our sincere appreciation to our sponsors for this event. So our gold sponsor, Novartis, our silver sponsors, Pfizer and Viatris, and our bronze sponsors, AstraZeneca and Roche. Our question and expert sessions are strictly dedicated to answering your questions. So there'll be no presentation from our speaker today, and she'll be answering live questions as well as questions that were submitted in advance. So you can use the question and answer button at the bottom or on the side of your screen to submit your question, and we'll try to take as many as we can. I'd now like to welcome our host for the session, Kathy Amandaleo, who is the chair of the board of the Canadian Breast Cancer Network.
Great, thanks, Bakun. Thank you, everybody, for joining. Welcome again. This is one of many sessions that we've had here at CBCN, and thank you for joining us. Today, I'm pleased to welcome Melissa Harley, who is joining us to answer all your questions about nutrition and nutrition following a breast cancer diagnosis. Obviously, nutrition is always a popular topic, and I'm sure we're going to get quite a bit of questions, and we'll try to answer them all if we can. Melissa Harley is a registered dietitian and certified diabetes educator with over 15 years work experience as a clinical dietitian. She currently works at Ottawa Hospital Cancer Centre. In this position, she provides nutritional support to patients as they navigate their cancer journey. She provides nutrition and diet education to help patients prevent and manage nutrition-related side effects associated with treatments. She also supports and manages patients receiving internal nutrition, which is tube feeding. Melissa, thank you for joining us this afternoon. It's wonderful to have you with us today.
Thank you, Kathy. It's certainly nice to be here, and thank you for inviting me. First of all, can everybody hear me? Maybe if Kathy, if you can just confirm that you can hear me.
Yes, we can hear you. We're all good.
We're all good. Okay.
Yeah.
And I just wanted to start off by saying that as per my introduction, I'm a registered dietitian and certified diabetes educator. And for most of my working career, I was working in the area of diabetes. When I graduated from nutrition and my internship, my primary interest was always in oncology, but the jobs just weren't there at the time, and diabetes was, and so I was sort of funneled into that direction. But I always had this interest and passion in nutrition and oncology. And so it was approximately a year ago, I had the opportunity to start doing some part-time 1-2 day a week at the Ottawa Hospital Cancer Centre. Mm-hmm. And that was approximately about a year ago. And then in May, beginning of June, 2022, just this last year, a position came up and I applied and I got it. So I by no means consider myself an expert, because I had to do a lot of learning to get the position, and I'm continuing to do a lot of learning. So I will try to answer your questions as best I can, but please be forgiving if I'm not able to answer all your questions. And if I do get a question that I don't know, I will just have to say at this point in time, I don't know the answer, and I will try to refer you to a resource or a website that will provide you that answer. So if that's okay, I'll just get started.
Great.
okay?
That's
Okay. All right.
That's very good. That's very
Okay.
good. It's great that you gave us a broader introduction of yourself.
Okay.
So with that,
Okay.
as we wait for participants to start submitting their questions, we're going to start with a couple of questions that were submitted in advance. So one of the questions that was submitted was, this person writes, I am wondering if there are any supplements or diets that would be beneficial for triple negative breast cancer, TNBC. I have read some studies done on mushrooms and chaga and wanted to get your thoughts on this.
Yeah, so as you mentioned, triple negative breast cancer, you're negative for estrogen, progesterone, and excess HER2 protein. So the growth of the cancer is not fueled by hormones or the receptor protein. As it stands, there really is no like specific diet, like the Canadian Cancer Society, American Cancer Society, other sort of oncology associations. It's not like they have like a set diet that they recommend, like high protein or low carb or anything like that. However, we do know that a diet that's high in fruits, vegetables, whole grains, high fiber diet is protective against all types of cancers, so particularly for TNBC, and also sometimes it's also avoiding certain foods such as processed food, saturated fat, trans fats, excess sugar, particularly refined processed sugar, in particular high fructose corn syrup is becoming a known carcinogen, limit alcohol and maintaining a healthy weight, that these are all helpful for reducing your risk for cancer. If you're dealing with a cancer diagnosis, these are diet recommendations that will be helpful for you during your treatment and certainly after, and that would include triple negative breast cancer. But when you take a closer look at more specifically, like what types of fruits or vegetables might be helpful or might have more cancer fighting ability for triple negative breast cancer, certainly there is a group of vegetables from the brassica family. So those vegetables are your dark green leafy vegetables like kale, spinach, romaine. They also contain broccoli, Brussels sprouts, cabbage. They contain certain compounds, two in particular, sulforaphane and indole 3-carbinol, that seem to have in particular cancer fighting abilities. And they do that in various ways, from reducing cancer cell growth to increasing your the cancer cell sensitivity to the chemotherapy agents that you're receiving. And this might be related to a reduced recurrence of breast cancer in those dealing with TNBC. Mm-hmm. Another food that or compound in food is that's cancer protective is omega-3 fats. They're found in fatty fish such as salmon, trout, nuts, in particular walnuts. There's some in avocado. They've definitely the omega-3 fats have definitely been found to help protect and you from cancer or recurrence of cancer. Green tea, drinking green tea. Green tea contains a very strong antioxidant called epigallocatechin. And it's been shown in experimental studies to reduce the growth and recurrence of breast cancer cells. Now that's in the test tube. We don't know if that necessarily translates in the human body, but certainly it certainly wouldn't be harmful to you to drink a couple cups of green tea a day. Mm-hmm. Now, when it comes to supplements, in general, like whenever I'm working with a patient, I always caution people on supplements. Supplements have a variety of risks associated with them. And so if we were to look at some of those foods that were promoted for breast cancer, in particular TNBC, going back to the green tea, certainly you can go to a grocery store or a health food store, and there's a variety of brands of green tea extract supplements. And some of those green tea supplements have been linked to liver failure. We have case reports of that. Curcumin is a very popular supplement right now. It's touted for anti-inflammatory, helpful for arthritis, reducing your risk for heart disease, but also cancer fighting. And it's known that curcumin supplements, when taken with certain chemotherapy agents, such as, and pardon my pronunciation, I'm still learning how to pronounce some of these chemotherapy agents, paclitaxel, which is a common chemotherapy agent used in breast cancer, that the combination of the curcumin with that particular agent leads to liver toxicity. And so chemotherapy has to be stopped, and and whenever there's an interruption in your chemotherapy, that can be an issue in terms of your outcome.
That's a great answer, and okay. I'm sure that other questions will involve some of the similar answers.
Okay.
So if it's okay, we're going to proceed with the next question. Now, this one is totally different, and this person is asking about lymphodemas, the secondary, to improve the secondary lymphedema, which is something that occurs to women. So is there any nutritional advice in very short answer? Do you have anything that might be?
Yeah, so again, with secondary lymphedema, we don't have any specific diet, recommended diet to target the secondary lymphedema, but we do know that it's very important to eat adequate protein. So the protein will help keep the connective tissue and blood vessels strong, so stronger tissue, stronger blood vessels will help prevent some of the swelling that's associated with the secondary lymphedema. So, and you're right, later on in my answers, questions, I can talk a little bit more about protein, but basically you want to make sure you include protein foods at meals and snacks, such as eggs, nuts, tofu, lean meats. A second dietary intervention is to try to limit salt. Now, it's not that you have to be on a low salt diet, but you just want to avoid really salty foods. So, potato chips, salted nuts, salty crackers, salty canned soups, limit the amount of table salt that you add at the table. That might help reduce some of the swelling that's associated with the secondary lymphedema. And I just want to put in a plug here for physiotherapy. Physiotherapy is actually very helpful in managing secondary lymphedema. A physiotherapist has various exercises, massage techniques. Sometimes they recommend compression bandages and things like that. So if you're dealing with secondary lymphedema, you might want to ask your doctor for a referral to a physiotherapist.
Excellent. Wow, that's good, because we have not come across this question. Thank you so much for answering that. And moving along, we're going to go to live questions. Bakun, did you get any?
Of course, yes. So you had mentioned about the benefits of green tea. So someone wanted to know if red tea, so rooibos, has similar benefits, or how does it compare to green tea?
So the red tea, the rooibos tea, it's very rich in antioxidants and flavonoids. So these are, phytochemical compounds that have many health benefits. One of them is cancer fighting. So yes, I think that the rooibos tea, the red tea, would be fine, just like green tea. If anything, the rooibos tea has the added benefit that there's no caffeine in it. Absolutely no caffeine. Green tea has a little bit of caffeine in it, not as much as black tea, but the rooibos is completely caffeine free. So that would be a good tea to drink as well.
Perfect. And so many of our breast cancer patients, they might suffer from bone health. So after getting diagnosed, because of the treatments that they're getting. So we have a question here. So someone, because of they're currently in active breast cancer treatment, and they have severe osteoporosis. So they're wondering if they can get any nutritional advice on improving their diet in order to increase their calcium levels.
Yeah, so bone health is a big issue in patients dealing with breast cancer and going through the treatments. So, we have to go back to the basics if we want to increase calcium and vitamin D through diet. Number one that comes to mind, of course, is your dairy products. So milk, yogurt, cheese. When they convert milk into cheese, they actually lose a lot of calcium. So it's not the best source of calcium, but it is a good source of protein. Calcium and vitamin D fortified plant-based milks like almond milk, oat milk, they can be a good source of calcium and vitamin D. Calcium is found in some of your dark green leafy vegetables, such as broccoli. It's found in almonds. It's just that the calcium that's in the plant foods, it's not as available for your body to absorb. And you have to eat a large volume to get significant amounts of calcium. Just where I work with the oncologists, the oncologists that I work with, they do tend to prescribe a calcium supplement and vitamin D in those cases where bone health, bone density is a concern. So it would be very difficult to meet your calcium and vitamin D requirements in that situation where you're taking the hormone blockers and the medications, the anti-estrogenic medications. They will impact your bone health, and it's really hard to counter that by diet alone. We usually need to use supplements, and I work with oncologists in suggesting a recommended amount of calcium and vitamin D to take in a pill form. And so I would encourage you to talk to your oncologist about taking a supplement. If there's a dietitian at the cancer center where you're getting your treatment, I would ask to be referred to the dietitian to help you with that. Does that answer your?
Oh yeah, for sure. Yeah, no, I think that's definitely helpful. Yeah.
Okay, that's great. So I'm going to go back to some pre-submitted questions. So one of the questions is, this person was prescribed a natural medicine, probably some natural product that contains and she states 400 milligrams of flax. There are various opinions on whether flax can cause cancer to grow or reduce the growth. So the person had a diagnosis of ER positive breast cancer, which means she was hormonal dependent, and 10 years ago, but has remained cancer-free, thankfully. And now she doesn't want to risk the cancer returning. Can she safely take this medication, or how do you go about deciding to take it or not to take it?
It's a little hard for me to answer that question without knowing the particular product. Like, natural medicine, I'm thinking it's a supplement, and 400 milligrams of flax. So I don't know if that's the actual like ground up flax seed or a flax seed extract or the flax oil. And you really need to know what's in your supplement, and what's the bioactive compound that you want to get in the supplement. In that supplement, does it have that bioactive compound? What's the dosage? And it really varies from brand to brand. I tell people, if in general, when it comes to any type of supplement or sort of natural medicine recommended by a naturopathic doctor, I would always suggest to discuss it further with your oncology team. And if you are going to choose a supplement, you want to look for brands that are labeled with a stamp or a seal that says it's been third-party verified that the product actually contains the bioactive compound in the dosage that the label says it does. And just going back though to that whole flaxseed and breast cancer, and I was just kind of teasing. I just want to try to tease that question out. I was wondering if the person who submitted that question, if they were wondering about, so basically flaxseed, it has a compound in it called lignin, and lignin is a type of phytoestrogen. And I do talk about phytoestrogens later on in my presentation. I addressed that in another question. And so short answer is that phytoestrogens probably have a protective effect. But when it comes to the flaxseed, certainly if you're taking the whole flaxseed, if you grind it up, you'll get the lignins, and certainly there are health benefits associated with that. But the lignins are only found in the flax seed. So if you're buying flaxseed oil or flaxseed oil supplements, you're not getting the lignins, and that's the bioactive compound in the flaxseed that you want for the cancer protection.
Okay.
Yeah.
I don't know. Kind of answer.
Yeah, so I would just add to that anybody taking any volume of natural products should always verify with their doctor, and also bring with them additional drugs that they are taking for any comorbidities, because it may not be what they're on for their cancer, but it could interfere with whatever else they're taking. So I think you're right in the sense that anything you take, even if it's something that is labeled as natural, it's never a good idea to take it just to take it. It's always a good idea to verify.
Yeah, and I just wanted to add that, yes, there are risks. If you are taking a flax oil supplement or a flax seed supplement, they are associated with increased risk of bleeding. They're associated with nausea, vomiting, diarrhea, and there are some medication interactions. So yeah, that was going to be my final point, was that, yeah, there's always risks with supplements.
Right.
Yeah.
And you always have to verify.
Yeah.
So my next question, it's another submitted question. So this person is a breast cancer survivor of almost 4 years who follows a plant-based diet, and she'd like to try more vegan recipes, but many have soy, tempeh as an ingredient, and is wondering if this is an okay ingredient. Can she eat soy products? Should she avoid them? There's a whole controversy about soy products. One time they're telling you not to consume too much, especially if you are ER positive, and then there are other studies that tell you. So very briefly, what are the do's and don'ts in terms of consuming these products?
Yeah, so I just wanted to add that, yes, there's lots of confusion about soy and breast cancer. And yeah, if you want the condensed version of my answer, I can give you a longer one, but I'll give you the condensed version. So the BC Cancer Agency has actually a great resource. It's called a Nutrition Guide for Women with Breast Cancer. It's a 72-page booklet that you can access on their website. And on page 34, they summarize all the research to date. And basically their conclusion is that the most recent evidence that they have is that soy foods are safe for breast cancer survivors when eaten in amounts similar to Asian diets. And that's 2 servings per day. They do recommend to avoid soy supplements. Again, when we get into supplements, you're concentrating the bioactive compound, and whenever you do that, you can get unwanted effects. The BC Cancer Agency booklet does say that it's unclear if soy foods will prevent recurrence of breast cancer, but certainly it's not going to increase your risk for a recurrence of breast cancer. So the emphasis is on the whole soy foods. So that would be things like tofu, soy milk, edamame, soy nuts, and a serving would be like 1 cup of soy milk would be 1 serving. 3 ounces or a 1/3 cup of tofu would be 1 serving. 1/2 cup of edamame would be 1 serving. I just want to add that when you are choosing soy products, I would look for non-GMO. That would be my number 1, actually, is look for non-GMO, non-genetically modified. My second, after non-GMO, if you can also get organic, that would be an added bonus. But first priority is the non-GMO. So when I was going through university, which is a few years back, the recommendations for soy and breast cancer and other hormone dependent cancers was to have 3 servings a week. And so now if we follow what the BC Cancer Agency is suggesting, they're saying it's okay to have 2 servings a day. So I think I would leave it up to the individual to decide what they're comfortable with in terms of number of servings, if they want to have 2 servings a day versus 3 servings a week. But by far, I would say the current research supports it's totally safe having 3 servings of soy product, whole soy foods a week. And
Right.
when you mentioned, when the participant mentioned about having soy or tempeh in their vegan recipes, I was envisioning maybe like a tofu stir fry with lots of veggies, carrots, green and red peppers, and bok choy, and all those vegetables have lots of phytochemicals that cancer fighting phytochemicals that would be very protective. And I think if there was any risk associated with the phytoestrogens in the soy, it would totally be countered by all those phytochemicals in the vegetables. So I think soy foods are I think they are a safe choice. My just full disclosure here, my mother is a breast cancer survivor, and my doctor has said I'm at a higher risk for breast cancer. And so for a while there, I did avoid soy foods, but now I have been putting them back into my diet because I miss them, and they're nutritious, and I feel that there is enough research to say that they are.
I guess one would say that do it in moderation. Do it in moderation.
Yeah.
They give you the big
Yes.
amount, and you're used to not having any. Go in the middle, and just make yourself feel good about it one way or another. So we're
Right.
going to move on. I'm sure we have more live questions. So Bakun, let's do that.
Yeah. So just to state, so the BC nutrition guide that you had brought up.
Yes.
So just so everyone knows, I've added the link in the chat. So that's going to open to the direct PDF. So if anyone wants to have a look at that after the session, you can have that. So this is related to kind of the whole idea of like foods, of like what to eat and not what not to eat, and kind of the research. So another big one that we know and get a lot of questions on is the relationship between milk and cancer. So can you speak more to that, especially with like, the hormones? Does it feed breast cancer? Is there amounts that should be, should you be staying away from milk, or can you safely drink it?
Yeah, and I'm going to assume you're referring to cow's milk.
Yes.
Yeah, the dairy products.
Oh, yeah, I think that's what they're referring to.
Yeah, so Canadian milk that's sold in Canada for the most part, if you go with the name brands, they're milk that's produced by Canadian farmers. And the dairy industry in Canada is heavily regulated, and our milk is constantly tested for the presence of hormones, antibiotics, and other chemicals, drug residues, that sort of thing. Yeah. So when it comes to drinking Canadian milk, I feel very safe. I don't feel that there's extra hormones or antibiotic residue in Canadian milk. Now, there was a recent change in some of our trade in dairy products with the US. And so the Canadian government has now allowed a small selection of American dairy products into the market. And I do tend to avoid those because the American dairy industry is regulated differently. They allow different levels of hormones and antibiotics to be used in the dairy cows, and they don't test as often. And so I think there is the risk that there could be higher levels of hormones and antibiotics and other stuff in American dairy products. In general, dietary calcium from dairy has been shown to be protective in different types of cancer, in particular colon cancer. I'm not aware if there's a specific protective effect in breast cancer, but certainly I do know that adequate dietary calcium from dairy products does protect you from other types of cancer. So.
Oh, okay, so it's basically not that, it's just dairy is just a no, or it's kind of
Yes.
more based on
Yes.
potentially where you're getting it from. Okay,
Yeah,
that's good
exactly.
to know.
Yeah.
So there might be a big list for this, but this is a question that always comes up. So if you were to say like top 5 foods, like what is like the top worst foods to eat that are like a no, maybe not maybe specific for the certain types of cancer, but maybe just breast cancer in general, are there any, or is it really dependent on like the person, the amount, or anything like that?
Yeah, I do feel that, you know, it does. I like to kind of look at the whole diet, and the whole diet does kind of depend on each individual person, because it takes into factor your, cultural, religious preferences, work schedules, that sort of thing. And I try to discourage people from focusing on single foods, but when you ask me for certain foods to avoid, there are some foods that immediately jump to mind. And so the first one would be processed meats. So, things like bologna, smoked meats, hot dogs, corn dogs, all that kind of stuff. They have lots of chemicals and preservatives in them. And some of those chemicals are referred to as nitrosamines, and they're known to be cancer causing. The smoking process of when they smoke meat, it produces carcinogens. So I definitely would suggest avoid processed meats.
Yeah.
Concentrated sources of high fructose corn syrup. So that's high fructose corn syrup is found in, sugary drinks like Gatorade and Kool-Aid. When you're looking at those types of fruit flavored drinks, you can look for high fructose corn syrup. All those little Debbie cakes and all that kind of junky sweet baked goods that you find at the corner store, they're all full of high fructose corn syrup.
Yeah.
I would definitely stay away from that. Foods that are high in trans fats, so deep fried foods, it all kind of falls back into like your processed foods, like breaded chicken nuggets, breaded chicken burgers, deep fried potato chips. Those types of foods I would stay away from. Soft drinks, alcohol. Alcohol now has been been identified as that there's no safe level of alcohol consumption that we can recommend, and some health experts are suggesting that cancer warnings should be put on the label of wine and other alcohol spirits. I don't know, did I get 5 there? I think I might have gotten 4.
You've got the 5, but it's true. I did read that about the alcohol, and that was really sad to read that it has been downgraded again. But like everything, I think people that are listening should always keep up to date with things, because some days they'll give you one a piece of information around a food or a beverage item, and then another time they'll come up with different research. But I think in general, again, it's be moderate, play it safe. If it's not if it's salty, if it's too chemically, like if that's a good word, then you stay away from it as much as possible. I find that with patients that I speak to, because I'm a peer mentor, if they stay away from everything completely, it's harder. So if you want that little something every once in a while, sometimes it's okay to say, I'll have a glass of wine, or speak to your doctor and see at what level, right? That you're at.
And I guess too, I was always I was a little nervous at the beginning of the question about the whole avoid part, because I realized that avoid is a strong word, and it's sometimes it's just hard to avoid these foods all the time. And
maybe we should say limit then. Limit. Foods to limit.
Yeah, limit. Yes. Limit.
And again, every individual is different, and they should always speak to their cancer center and the people that work there. Speak to the dietitian, and just go with your doctor and nurses and see where you're at in that specific in your current situation. So I'm going to move on. We have many questions still. So this is around I'm going to move to this very vaguely, broadly. What kind of lifestyle diet changes should one be making? And this particular one is a person who has ER positive, PR positive, and HER2 positive breast cancer. So does that differ from another cancer type of breast cancer? Like what in general, what are your small, tips on lifestyle diet changes once you've been diagnosed?
Right. So when it comes to the diet recommendations for the ER, PR, HER2 positive breast cancer, I would just fall back to the same for the triple negative breast cancer. So you want to have, the lots of fruits and vegetables, the whole grains, omega-3 fats. You want to avoid the processed foods, limit the processed foods as much as possible. So I would fall back on those same recommendations.
Right.
For ER positive, PR positive breast cancers, they're going back to the dairy. Fermented dairy products might have a slightly protective effect. So in terms of slowing breast cancer growth and preventing a reoccurrence. So fermented dairy products would be things like yogurt and kefir. So that might be some other foods that you could add. The omega-3 fats with the fatty fish, avocado. Again, we talk a lot about diet, and diet is definitely very, very important. But I just want to also say, when it comes to lifestyle, exercise. Exercise is also a very important piece to this. So it doesn't have to be strenuous going to the gym, but a 20 to 30-minute daily walk, either outside or on your treadmill if you have one. Resistance exercise, or even isometric exercises, which are kind of the type of exercises you get when you do yoga. That would be a helpful component, like that would be part of a healthy diet and lifestyle when you're dealing with that type of diagnosis. Yeah.
Okay,
whether you're actively going through treatment or you've done your treatment and you're worried about what you want to prevent a recurrence.
Okay, great.
Yeah.
So the next question is around diabetes. And what they want to know is it possible to develop diabetes after chemotherapy? And generally speaking, is there any connection between cancer and diabetes? Now, that's a loaded question, because there is studies and lots of research between to answer any questions that we have with diabetes and cancer. So we can't get too medical here, right? None of us are doctors. But what about in your knowledge and in your work? Do you see this? Do you hear about this? People who develop diabetes after chemotherapy?
Yes, so it definitely is a possibility to develop type 2 diabetes during chemotherapy. So that's different from type 1. And I'll let your participants research the difference between type 1 and type 2 on their own. But type 2 is more adult onset. And yes, the type 2 diabetes, it can develop either during chemotherapy or after. Some of the chemotherapy agents increase blood glucose. And so if you are genetically predisposed to developing type 2 diabetes, when you're going through chemotherapy, if the agent increases the blood glucose, in addition to that genetic susceptibility, it could just turn the switch on for developing type 2. Also, sometimes we have to use steroids during chemotherapy. And again, steroids are known to raise blood sugar, and they can trigger the development of type 2 diabetes. And that can happen during chemotherapy, or it can happen after. So I definitely do see it. And that's where I combine my diabetes background here at the Cancer Centre in helping cancer patients deal with a new diagnosis of diabetes.
And I wonder if this could be corrected over time. Would this be a temporary thing, or do you?
Yeah. So if it's steroid-induced diabetes, sometimes once the steroids are dropped or stopped, the blood sugars go back down, and there's no diabetes. Unfortunately, in some people, once the steroids are stopped, their sugars still stay high, and then they do have type 2 diabetes. And it's kind of assumed in those people who continue to have type 2 diabetes after steroid use that they probably have a genetic susceptibility to developing type 2 diabetes. So they might have developed it later on in life. I mean, not that I'm trying to trivialize what happened, but that could have been a contributing factor.
Right. Yeah. Thank you. Bakun, do you have any more questions? We're really ramping up time here. This is great. Go ahead.
So this is actually related to chemotherapy, and then it's kind of back to the questions about like food and like specific on nutrition. But is there anything that someone who's on chemotherapy that they can take to both help their body absorb the chemotherapy as well as get rid of the chemotherapy? Like if you're being treated with chemotherapy, like are there certain things that you should be eating?
Okay, yeah. So I'm just going to I talked a little bit about that, about what can increase the effectiveness of chemotherapy, but in terms of getting rid of the chemotherapy agent, which is actually something, you know, that we want you to do, because the chemotherapy goes in, it targets the cancer cells, but it's also going to target a healthy normal cells. So we don't want it hanging around in your body for too long. So it's really important in those first 3 days of your day 1 of chemo and the 2 days after that you drink lots of water. Water is going to flush out the chemotherapy agent that once it's done its job. So that's really important. That it's recommended to try and drink 3 liters of water a day. That's hard. I know. But 2 liters for sure. And so that's really important. In terms of increasing the effectiveness of the chemotherapy, I believe when I was looking through the research that it was the ground flaxseed, the lignans in the ground flaxseed that help increase the effectiveness of the chemotherapy agent. And again, some of the phytochemicals that are found in your dark green leafy vegetables, also in red and purple fruits and vegetables. So think red grapes, beets, red cabbage, purple cabbage, think of the more colorful fruits and vegetables, watermelon, they have certain phytochemicals that kind of enhance the job that the chemotherapy does.
So they can take these and then just make sure that they drink a lot of water to kind of flush it out.
Water, in terms of getting rid of that chemotherapy agent, is the water is what's going to do it.
For sure, and then this is another related to chemotherapy. So one of the side effects that patients might get from chemotherapy is chemo-induced peripheral neuropathy. So is there any way to kind of address that with foods or any type of like nutrition, or is that kind of addressed outside of that?
Yes. So unfortunately, the peripheral neuropathy is associated with a few chemotherapy agents, and there's not much we can do diet-wise. If the peripheral neuropathy gets really bad, they reduce the dose of that drug, or they give you a break. I do work with a few oncologists who they prescribe it, a vitamin B6 supplement. But I wouldn't make a recommendation in this type of presentation. I would only suggest something like that you would go to your oncologist and do that. And again, I don't make that recommendation about the vitamin B6 supplement. That's something that the oncologist does. Also, another one is vitamin B12. Vitamin B12 is a supplement is also prescribed. So that's certainly a question you can ask your oncologist if you are dealing with peripheral neuropathy due to the drug.
Okay. So why don't we go back to Kathy for some of our pre-submitted questions?
Yeah. So I have one that's very simple. Is there any connection between sugar and cancer?
So you know what, I'm going to go back to the BC Cancer Agency. They just produced a really good fact sheet explaining the connection, is there a relationship between sugar in cancer? And if you go to their website, they've got the fact sheet that you can download. But in summary, If you have a diet that's high in refined processed sugar, that type of sugar gets absorbed in the blood very quickly. And if you're constantly eating sweets throughout the day, that high sugar in the blood increases the amount of insulin that your body has to produce. And insulin is fundamentally, it's an anabolic hormone. It builds, it makes cells grow. And so it'll make healthy cells grow. It'll also make cancer cells grow. And so the link is not so much that it's the sugar, but it's the insulin. So it's okay to eat carbohydrate, which is a fancy word for sugar that's found naturally in foods. So it's okay to eat carbohydrate foods like whole grain breads, brown rice, fruits, because there's fiber and other compounds in those foods that bind up the sugar. And so the sugar gets digested more slowly, and it tends not to cause the spikes in insulin. And so if you don't have high spikes in insulin or high circulating insulin levels in your body, there's theoretically less chance that insulin is going to stimulate cancer cells to grow. The glycemic index diet is a popular diet for people with diabetes, but the glycemic index diet is also helpful just for anybody for keeping their insulin levels within a normal range, which long term may help reduce your risk for developing cancer. And that would be for any type of cancer, including breast.
Yeah. So I have a question around this as well. So if you're watching what you eat and the amount of sugars, etc., if you're followed, obviously everybody that has cancer, they're followed very regularly, and it comes with a blood test. If your sugars are normal, how do you know if you're overdoing it on sugar or not? Or is that not an indicator?
Yeah. So if you've got a normal functioning pancreas, that's the organ that produces the insulin. The blood sugar result won't tell you if you've got lots of circulating insulin, because if your pancreas is working properly, it'll make the exact amount of insulin for the amount of sugar that you're eating. But you can request that your fasting insulin levels be tested. And certainly we do sometimes see elevated fasting insulin levels, even when blood glucose is normal. And that is kind of considered a pre-diabetes state. And, it could be an indicator that, either you're pre-diabetic or maybe your diet is high, it is a little too high in refined processed sugar. And I want to emphasize it's the refined sugar. It's the candy, it's the jelly beans, the licorice, it's the Coke, the soft drinks. Just keep in mind, like 1 can of regular Coke or any type of soft drink has the equivalent of about 10 teaspoons of sugar. And when you drink a can of Coke, you're getting 10 teaspoons of sugar. That's a lot of sugar in one serving. So and it goes into the blood very, very quickly. So it causes a rapid rise in your insulin. Yeah.
And speaking of the diet, of the colas and the soft drinks, what do you say around the diet? Because a lot of people switch and go to diet soft drinks or these type of drinks that have God knows whatever they have in it. And they tend to be addictive. I mean, these things, once you start with those, they really, you just gain some taste to this. So is there anything that you can speak to around that topic?
Yeah, I do limit, I do suggest limiting soft drinks, whether they're diet or regular in general, because so even if you go with the diet versions, they have artificial sweeteners. Some of them are chemical based, and if you have confidence in Health Canada. Health Canada says that aspartame and Splenda and all these other artificial sweeteners are fine, and that there's no increased risk for cancer. So if you feel comfortable by that, then I guess okay. But if you're not 100% comfortable with Health Canada's recommendations, you might want to limit it. There's also, as you mentioned, Kathy, there's other stuff in soft drinks, particularly the cola beverages. So what we're finding is that the caramel coloring that they use to get that dark brown, almost black color
Yeah.
in the cola beverages, that caramel coloring is associated with increased insulin resistance, potentially increased risk for cancer. It definitely increases inflammation, which is associated with the metabolic syndrome, potentially increases triglycerides. So it's just a whole host of negative effects in your body. So yeah, for sure you want to limit soft drinks. For me personally, after I read everything about caramel coloring, I now, when I choose a soft drink, I choose a clear one, like ginger ale or 7-Up. Also, there are alternatives. Like there's that buble, which is carbonated water with natural flavoring added to it. Some companies, I'm starting to see soft drinks sweetened with stevia. So I know I saw a brand in the grocery store where it was sweetened with stevia. Stevia is a plant-based sweetener. It's a natural compound occurring in a plant that has a sweet taste. So they use that instead of an artificial sweetener, artificial sugar. So that might be an alternative. Yeah. And then, yeah, so.
But again, it's particular to the cola. Let that cola taste.
Yes, I would say
cannot replace that cola taste without putting anything. There is nothing in the world. And once somebody becomes addicted to this, and if anybody's out there listening to this, I feel for you because I'm a victim of the cola taste. And it's just is what it is. So again, moderation. Gotta have it once a month as a treat. So, just like a glass of wine as a treat. So once in a while, let's do it and be done with it. We're going to move on. Let's see. Somebody's writing about taste changes after having chemotherapy. Is there anything that you could speak to in terms of what kind of food you could eliminate to balance out your taste buds, or what can you tell us about that sort of question?
Yeah, so taste alterations in chemotherapy is very common. That's a very common side effect. And again, I just want to start off by saying that both Cancer Care Ontario and the BC Cancer Agency have patient fact sheets with tips and suggestions on how to manage taste alterations. First thing is, again, hydration. Hydration is really important in managing those taste alterations. If you're a little dehydrated, you're going to start getting odd tastes from that. So drinking water throughout the day, sometimes, sucking on a popsicle is a way of staying hydrated. Depending on your taste alterations, so I know one person submitted a question where they said they were experiencing like a sour or a bitter taste. So if you're experiencing the sour and bitter taste, sometimes countering it with something sweet. So popsicles, like a fruit flavored popsicle, would have a sweet taste, and sucking on that might help get rid of the sour or the bitter taste in your mouth. Sucking or eating frozen grapes or frozen slices of orange might be another way of countering the sour taste. If you're having a metallic taste, it's sometimes helpful to switch to using plastic utensils, plastic fork rather than metal. It's the same thing with your cooking ware. It might be helpful to use glass cookware instead of metal pots and pans for cooking, or glass containers for storing your food. So those would be a few suggestions. If for sweet sensitivity, so some people experience an increased taste of sweet, like things are sickeningly sweet. We have to counter that with salt or something sour or bitter. And so I tell people to start adding salt to food that they normally wouldn't add salt to, just to try and counter the heightened sweet sensation on their tongue. And it has to do with how the chemotherapy affects the taste buds. And usually the taste alterations are temporary. Once the chemotherapy is finished, usually your taste buds go back to normal, and those odd tastes go away. So it's not hang in there. It's not permanent. And
Okay,
for more information, go to Cancer Care Ontario or BC Cancer Agency. They've got some great fact sheets on what to do to manage it.
Oh, great. Excellent. Bakun, I'm going to go back to you because we skipped a couple of questions from live audience. Go ahead.
Yeah. Someone was asking about dark chocolate. So 70 to about 80% cocoa. So is that good or used in moderation? Like how should they approach that?
Yeah, no, I think it's good. I would still say, yeah, have it in moderation. But yeah, the higher cocoa percentage chocolate, it's higher in the cocoa fat, which is a source of good fat. And also usually the chocolates that have those higher percentages, usually they're cold, what they call cold processed. So they're not using a lot of heat to make the chocolate bar. And so the cocoa bean actually has a lot of phytochemicals and flavonoids that have many health benefits. So those are preserved in those types of chocolate bars. They're also lower in sugar. So yeah, if you like the 70 to 80% or higher cocoa chocolate, that's a great option. They are a little more bitter tasting because they don't have as much sugar, but you get used to it. And it's a great way to satisfy a chocolate craving.
For sure. Yeah. So someone is going back to the question that we had on calcium supplements. And you can also answer this maybe generally in terms of when you're on certain treatments and you're introducing, diet changes or eating a specific food because of the treatment you're on. So specifically for this person, they're asking like they're currently on calcium supplements, but like is there a certain time that they should be using it? So they're taking letrozole for 5 years. So should they be kind of using the calcium supplements before treatment, during, after? Like what does that look like? And same for just like, if you're introducing a certain diet while you're taking chemotherapy, is it like before you're going to start this treatment, during, after, or just incorporate it into your lifestyle?
Yeah. So, and specifically to calcium and vitamin D, like, I just wanted to be clear about that. I'm answering the question that's being asked.
Yeah. So they're just saying so they're on calcium supplements. So when should they be taking it in relation to their letrozole treatments?
Yeah. So if you're already taking a calcium supplement, I'm going to assume that it was recommended or like prescribed by a physician. So I'm just going to go under that assumption. And so if that's the case, you would still continue taking it during your treatment and afterwards. If you're taking a calcium and vitamin D supplement before you start treatment and it wasn't recommended by a physician or a healthcare practitioner, I would suggest talking to your oncology team, the oncologist, about that, like why you're taking the calcium and vitamin D supplement. Like do you not drink dairy products, or you just don't get enough dietary calcium, and that's why? Are you at a higher risk for osteoporosis? Like there's just a whole bunch of questions that I have about why somebody would be taking calcium and vitamin D supplements before they start treatment. And then once you're in treatment, like you would only take the calcium and vitamin D if the oncologist was recommending it. So again, we wouldn't want you sort of self-prescribing when you're doing treatment, because yes, calcium supplements can interact with the medications that you're taking. So so you need advice about when to take them, time of day, that sort of thing. Yeah.
I have a quick follow-up question to that. Is there something that is standardized in terms of having individuals tested for vitamin D lack of? Is that commonly done, and perhaps that's the reason why some people are taking it, or is that not done at all?
Yeah, so vitamin D testing, at least all I can speak of is like here at the Cancer Centre, it's not routinely done. It's only done if they've been getting, or they've been started and they've been receiving a treatment and there's concern that their vitamin D levels are low, and they might be manifesting signs and symptoms of their bone density is being affected. So that could be an increase in bone pain, joint pain. So they would start looking at that. When it comes to vitamin D, though, in general, Canadians living in Canada, it does kind of put us at higher risk for vitamin D deficiency simply because of our geographical location. We, 6 months of the year, it's cold, winter, we don't get direct sunlight. And so Health Canada does have this general recommendation that everybody over the age of 50 should take a supplement, vitamin D supplement, 400 international units every day because of that, because of our location. People over the age of 50, even when we are in direct sunlight, our body isn't able to synthesize vitamin D as well as we get older. So that is a recommendation that Health Canada has. Anything above 400 international units a day, and typically what I'm seeing in the oncology, the cancer clinic here, the oncologists are prescribing like 1,000 or even more, 2,000 international units of vitamin D a day.
Yeah.
If that's when that is prescribed, they've usually done a vitamin D blood test. The person has been found to be deficient in vitamin D, and so they have to go with a higher dose to correct that. And then they do follow-up monitoring of the vitamin D testing. And once they reach equilibrium, they might reduce the dose. But you really shouldn't be taking high doses of vitamin D without some type of monitoring.
Right.
And you can do that through. You could ask your oncologist or your family physician to help.
Right. And again, this is not a very clear understanding by everybody.
No.
Not everybody has a family doctor, so that's one. B, not everybody reads the Canada Healthcare Guide. That's two. And it's not something, it's here, there, everywhere. But I guess if you're under cancer treatment, and I would imagine if, like you say, bones, if they're compromised because of metastatic disease, especially. So I guess those levels might be taken into account. Thank you.
Yeah, yes. And again, it's kind of left to the oncologist, like the oncologist would do that. That wouldn't be my role. I wouldn't be making those recommendations.
Right.
Yeah.
But it's good to talk about it. It just creates awareness with
right.
our
And these might be questions that you should go back to your oncologist with. Like should I be taking a calcium and vitamin D supplement? How much? When? Yeah. We've got a very good audience who is really on top of their stuff. But I'm gonna have you finish off some of the questions. Okay.
Yeah, sure. So someone's asking about the Ensure product, so those meal replacements. So is it good for an ER positive patient, and just also in general, like is using a product like Ensure good?
Yeah, so I certainly feel that Ensure and Boost has its place. So, if you are going through treatment and you're struggling with, appetite, loss of appetite, nausea, weight loss, I think that Ensure and Boost, those types of drinks definitely play a role, are helpful. I think in those types of situations, they're safe. I don't have any concerns. I recommend people drink them when they need to. If you have any concerns about drinking Ensure and those types of nutrition products, certainly there are. I have tons of recipes for making your own high protein, high calorie shakes with ingredients that you have at home. Sometimes buying like a protein powder and. As I said, using ice cream and other ingredients that you have in your home, you can make a nutrition drink very similar to Ensure and Boost. So if you are receiving treatment at a cancer center, which I assume you are, they should have a dietitian on staff. And I would just suggest that you ask to speak with the dietitian if you feel you need that type of product. And they can help you, choose what type, because there's all kinds of different Ensure. There's all kinds of different types. There's Ensure Plus, Ensure High Protein, Ensure for people with diabetes. So there's, they can help you choose, something that's appropriate for you. If you're not comfortable with using those nutrition drinks, but you need, you need a nutrition supplement, they would have recipes for you to make some at home. So
we
lots of
didn't get, yeah, and keeping in this topic, we didn't get any questions around the, I don't know if we have any live ones, but you know, those powdered protein creations in these big barrels that you often see at the beverage counter at a gym.
Yeah.
Yeah.
What can you say around that? Because I always find that it's a huge barrel and it's got a huge amount of details of what's in it. That's kind of scary.
Yeah. So I would definitely suggest people avoid buying protein powder at the gym, because they're for people that are bodybuilding, typically young men in their 20s, and they're very high protein. So they could be up to like 30 grams of protein per scoop, which, you know, for someone who's older going through chemotherapy, that 30 grams of concentrated protein, that could be too much for your kidneys. For the same reason, I caution people on using the Premier protein drinks. Again, they're formulated for the gym crowd, people that are into bodybuilding, 30 grams of protein, but very low carb. People who are going through treatment, they need the carbs as well as the protein, and 30 grams is usually too high. You can get protein powders that 15 to 20 grams of protein per scoop. That's a more reasonable amount. When I recommend a protein powder, it's usually because the patient is not eating enough protein food. So I always like to focus on food first, and only when they come back to me and say, look, I just can't eat these eggs, this chicken, whatever, then I say, okay, well, we'll start looking at the Ensure drinks, or using a protein powder, and different ways that you can mix the protein powder in. So again, I would suggest that you speak with a dietitian. If you think you need a protein supplement, like a protein powder, because there's definitely certain types of protein powders that I would direct people to choose, and they're available at Shoppers Drug Mart as opposed to the gym. Right. Yeah, like I wouldn't go to Popeyes.
Right.
Yeah.
But and I guess too, I mean, in keeping with what amount does somebody take and who takes what? Size of a person, I guess, male, female. So I guess the consumption should be really regulated according to the person.
Yes, it should be individual recommendation. You might just need one scoop, divided in half, twice a day. Like, you definitely need some advice about how much you need to take per day, in, how, when, that sort of thing. Yeah.
Right.
Sure.
Great. Yeah. Bakun, is it you or is it me right now?
I'll ask one and then we'll go back to you.
Okay.
So we have someone who is experiencing muscular soreness around their radiated breast, as well as joint pain in their hands. And this is after taking an aromatase inhibitor. So is there any type of food or nutrition that they can take to address this type of soreness, or is this kind of more something that you think would be maybe for like a physical therapist or massage or something like that, or can you address muscle and joint pain through food?
Yeah, so the joint pain and muscle pain that is associated, like that is a side effect associated with the aromatase inhibitors. So I would just again mention it to your oncologist, like that maybe they need to look at the dose or amount or that sort of thing. Physiotherapy definitely has a role. They might have some exercises or stretches that could help relieve that. I did come across a few studies that showed vitamin D supplementation might be helpful in relieving some of those symptoms. But certainly, again, I wouldn't just carte blanche go out and take a bunch of vitamin D. I would definitely go, talk to the doctor first about it. I can't really think of any specific food to address that joint pain and muscle pain. I mean, again, the omega-3 fats, if you have regular consumption of foods that are rich in omega-3 fats, that might be helpful, because the omega-3 fats can help reduce inflammation and any pain, joint pain in particular. but yeah, it's
Not directly, yeah.
yeah, it's more directed, it's more related to the drug.
Yeah.
For sure.
For sure. Okay, Kathy, go ahead with their submitted
Sure.
questions.
So I have a question around neutropenia. So neutropenia is as a result of having chemotherapy, and it depletes some of your blood cells. Are there any foods that they can eat to bring back their neutrophils?
Yeah, so again, the neutropenia, it is a known, that's directly affected by certain chemotherapy agents. And sometimes to correct it, they do have to like reduce the dose or take a break from it. There really isn't a specific, food that can prevent that from happening when you're taking that chemotherapy agent. That being said, certainly eating adequate protein would be helpful. It wouldn't hurt you. So we know that the immune system uses protein to make immune system cells such as white blood cells and neutrophils. So if you weren't eating enough protein, that could potentially put you at risk for neutropenia, theoretically, if you were also taking the chemotherapy agent known to cause that. Again, there's just a few oncologists that I work with here. They do recommend vitamin B12 and folate supplements for patients that are on certain chemotherapy agents that get neutropenia. And that's just a few oncologists that do that. That's certainly not all here. So it's something that you could look into but certainly eating foods that are rich in vitamin B12. So that would be your animal products, meats, eggs, particularly the egg yolk is a good source of vitamin B12, and folic acid, that's in your dark green leafy veggies, orange juice, that sort of thing. When you do have neutropenia, when it comes to food, actually what's really important is food safety. So when you have neutropenia, you're at higher risk for getting a foodborne illness. So you want to make sure that you follow safe food handling procedures, keep cold foods cold, hot foods hot, avoid cross-contamination, avoid consuming raw foods like raw egg or sushi, raw fish, that sort of thing. Wash your hands. Yeah, that's really critical. Yeah.
Great. And that would be in combination with the neutropenic drugs that somebody would get, because if you're at a very low level, they will give you something to boost your neutrophils in order for you to move forward with your chemotherapy, especially at your next session.
Yeah, that's right. Yes. Yeah.
Okay. So that's in addition.
Yeah.
Okay. Cool.
Yeah. So someone went back with the we're going back to the green tea.
Okay.
So just in terms of its benefits, like would it interact negatively with any treatment? So for this specific person, they're asking about palbociclib or letrozole, but just in general, like do you know of any bad like interactions with green tea and cancer treatment?
So if we're talking about the green tea, the beverage, like no, we don't have to worry about any interactions. And 2 to 3 cups of green tea throughout the day is considered safe. It's considered a safe level of green tea consumption. It's only when you get into those green tea supplements that you run into trouble. But if you're making a pot of green tea or you're having a cup of green tea with your breakfast, not a problem.
Perfect. And then related to like drinks that you would drink in the morning, so coffee. So a lot of people are coffee drinkers. It does contain the caffeine. Yes, caffeine. So there's too much coffee or caffeine. They want to know if it causes cancer, but also just what can you tell us in general in terms of coffee and caffeine and breast cancer?
Yeah, so I'm personally not aware of any research or statements about regular coffee consumption and increased cancer risk. I myself drink several cups of coffee a day, so I'm not aware of it. I think when it comes to like when you're going through chemotherapy treatment and certain types of radiation treatment, so again, coffee, depending on how strong you make it, can be very high in caffeine, and caffeine is a diuretic. So a diuretic will make you lose water. And so we know that when people are going through chemotherapy, that sometimes getting adequate water intake can be challenging. So when they drink something that, like a strong coffee and it's got a lot of caffeine, and that caffeine's acting like a diuretic, it's not helping the situation.
Yeah.
So sometimes, I know the nurses here, they'll tell patients when they start the chemotherapy to limit their coffee intake. It's not that coffee is bad. It's just that it's the caffeine, and they're worried about your hydration status. Decaf coffee is very low in caffeine, and it's almost like drinking water with a weak coffee flavor. So if you like decaffeinated coffee, most I say that's okay. I've spoken with one of the nurses here. They say that's fine too.
Mhm.
So that could be, if you're really worried about your caffeine intake, you could switch to the decaf coffee. But in terms of whether it's bad or not, I think coffee's fine. Yeah.
Perfect. So this is a big question, but if you can just maybe give us just your few thoughts on it. Fasting. What are your thoughts on fasting?
So I'll just preface this by saying that I work mainly with patients that are in active treatment. So they're actively going through chemotherapy or radiation treatment. And in my mind, they're already going through they're already fasting because the chemotherapy is affecting their appetite. They've got taste alterations, nausea, vomiting, they're not eating. I deal with patients that get radiation treatment to the head, and so that affects their ability to chew and swallow, so they're not eating. And so I wouldn't, in that situation, I wouldn't ask them to fast because they're already fasting. And in that situation, the fasting is not helping them. They're losing way too much weight too quickly. That weight that they're losing is muscle, and it's causing other problems. So in my role here, I don't talk about fasting. I don't encourage it. I am aware that fasting, intermittent fasting, it's being promoted in social media. I guess, for a variety of benefits, one of them being, fighting cancer. I can't really comment on that because I don't really work with, as I said, I work with this population of people that are going through active treatment, and that's kind of my focus. They keep me really busy, and I just haven't really had the time to really look into whether intermittent fasting can prevent cancer, prevent recurrence of cancer. I would have to refer you to someone else. And I am aware that there is a dietitian in the Toronto area that on social media, she claims to have specialized in intermittent fasting for cancer. So I could give our coordinators, Bukan and Kathy, the name of that dietitian after our presentation. I don't have it at the right on hand. If someone was really interested in pursuing that, but where I work, I can't recommend it because the people aren't eating already, and they're getting problems. They're getting problems from not eating. So
for sure.
Yeah.
I mean, I've met a different situation.
I've met people who have had their cancer treatments and are now living beyond their cancer journey. And they do this fasting because they want to lose weight, either because they've gained weight because of their tamoxifen and their Femara, because some people do gain weight with that, or just simply because you're not doing as much, etc. And one question that came up was that if you need to consume X amount of calories, whether you consume them during a shorter period or a longer period, does that make a difference? Maybe that's a question that should be, answered, because as long as you're consuming the calories that you need, if you're going to eat them early on in the day and then say, I'm just going to have a beverage for the rest of the day, eat a salad and not eat the heavier stuff, so maybe they're talking about a variant of what they mean by fasting, because everybody has a different approach when it comes to this fasting.
There's the one, as you say, there's the 1 meal a day, and then there's time restricted fasting, and there's all kinds of variations. I agree, and I just haven't been able to take the time aside to adequately look into it.
Great. So I think what's happening here is that we're coming to the point where we're almost ending the session, but I'd like to ask two pre-submitted, well, actually one, before we sign off.
Mhm.
And the question is, this person lives in a rural area and doesn't always have easy access to support services like a dietitian. Is there a website that she could go to and find registered dietitians in her area, or ones that can access virtually? So briefly, what does one do when they're not in reach with a whole center that provides all these professionals?
Mhm.
Right. Yeah. So if you're looking to find a dietitian, the website I would recommend is Dietitians of Canada, www.dietitians.ca. They have a find a dietitian button that you click on, and it's a database of dietitians across Canada. And you can search according to the province that you reside in. And then within the province, you can break it down to the region of the province that you live in. And it lists the dietitians that are working and where they work, whether it's in hospital or private practice, and contact information. And certainly it's mostly the private practice dietitians that offer virtual services.
Mm.
And so if you're in a rural area and you want to see a dietitian in a city, the private practice dietitians offer a lot of virtuals. They'll do Zoom sessions. But even here in Ottawa, I also, as part of my job here at the Cancer Centre, I also offer virtual services,
Okay.
as long as you're a patient of the Ottawa Hospital Cancer Centre.
Yeah.
So if so you depending on like where you live and what dietitians are listed there, you can start looking. You could try contacting dietitian that works at a hospital and see what their policy is in terms of seeing patients. Like, do you have to be a patient at their center?
Mhm.
And then you could follow up with private practice. But Dietitians of Canada would be the first place that I would look at.
And very briefly, if they have specific, like we have many that are, what about aspirin and vitamin D? What about eggs and tamoxifen? If you have questions like that come to mind, how would you tell somebody to go to what is it that you would say to them instead of going just all over the place on the internet?
Yeah.
How do you search the right information? What is one thing that you would give them as a key essential?
Yeah, so my first go-to for me is I go to PubMed.
Okay.
That's a database of published studies.
Yeah.
And it has a search engine at the top, and you just type in whatever it is that you want to reach, what want to know about, like, aspirin and cancer, or
Right.
vitamin C and breast cancer.
Right.
And you enter that in, hit return, and then it brings up a bunch of titles of published research studies that have looked into that question. And then they give you links to the article. Sometimes the links to the article are publicly available, sometimes they're not.
Right.
So
Right.
PubMed would be a place, but another I might just refer people initially, check out Cancer Care Ontario. Check out their website. Cancer Care Ontario has lots of teaching resources geared for people going through treatment. They have resources for all different types of cancer, chemotherapy agents, hormone therapies, and they have a lot of information. I'm constantly going to Cancer Care Ontario for my own learning. And they present the information in a way that's easy to read, easy to understand. And if I can't find what I'm looking for at the Cancer Care Ontario website, I go to the BC Cancer Agency. They seem to have slightly different information available, but it's all very current. So both Cancer Care Ontario and BC Cancer Agency, you know what, they kind of do my work for me. They kind of go into PubMed and collect all that research and summarize it.
Excellent. That's a very good point.
Maybe Cancer Care Ontario and BC Cancer Agency would be better places to start than PubMed.
Good tips instead of just going all over the place. Well,
Exactly.
this now brings us to the end of our session. And to close the session, I would like to thank everyone for the excellent questions. They were phenomenal. And I'd like to thank Bakun for putting this session together and bringing on the live questions. And of course, thank you, Melissa, for the
Okay.
great and engaging discussions that we've had here this afternoon. And thank you to all the participants for attending. And after this session, you will be sent a survey to provide feedback on this particular session. Please fill it out. The survey, as your responses, will help us make these sessions better as we move forward with other sessions. Once again, thank you to our sponsors, Novartis, Pfizer, Viatris, AstraZeneca, and Roche, who made all these this session possible. And thank you, everyone, again. Have a good evening and have a great day, everyone. Till next
Thanks,
time.
everyone.